At what age should I get a hair transplant? Hi, I am Dr. Arvind Poswal from Dr. A's Clinic, Delhi, India. This is a common question which many patients ask me because they have been told by different people, different doctors, that you are too young, you should not go for a transplant. So here I beg to differ. Why I differ is because nowadays hair loss is occurring, baldness is occurring at a very young age. Earlier I used to see people getting bald at 30-35 years of age. Now I see very young boys getting bald at 18 years, 20 years of age. So if we were to refuse them saying that you are too young just because it is written in the textbook, then that would be a wrong thing. Earlier we had limited number of grafts. Doctors could take out only head hair grafts. So we had around 3000 or maybe 4000 grafts that could be placed on your head. As a reason, when young people used to come and saying that they want a very young hairline, doctors were supposed to refuse them, because if you put all your grafts on the hairline and you turn bald in the back area, then what will you do? You can't be roaming around with a hairline like Joe Biden, that the president of USA. He has a transplant in this front area only and nothing in this top area. So that was the reason. But now a lot of things have changed. Now we can take out grafts from the beard also, from your body, chest area, pubic area, armpit area. So the donor reserve now available to patients is almost 14 to 15,000. Some patient even 20,000 grafts. So in such a condition, for me as a doctor to refuse hair transplant to a 22-year-old boy only because he is 22 years of age would be wrong. Why? This is the age when he has to do everything. He is finishing his study. He is looking for a life partner, his girlfriend, he is looking for a new job also. So at this time he can't go with the bald head. He will not get what he wants that way. So the correct way is the patient should sit down with the doctor and see how much total donor he has. Once he knows that, okay, total donor is, let's say, 15,000. And then we see that, okay, he has lost 2 or 3 finger of worth of hair in front. So we want to put 3,000 grafts in this area. Then there will be no problem, because there is still a lot of more graft left for us to put in the vertex and crown area if he loses hair in that area. So let not the limitations of your doctors stop you from getting your hair transplant at the age that you want to get it. Why did I say this? I said this because not all doctors can take out 15,000 grafts. I have taken out 6,000 grafts from the beard of most of the patients. I have taken 9,000 grafts from the beard of one of the patients, and he has to shave even now. So there are a lot more grafts now. So what I do and what I advise young doctors also is to not follow the outdated consultation methods. Sit down with your patient, see how much total donor hair he has, how much head donor he has, how much beard, how much body hair. For the patient also, look in the mirror, you will have the answer. There is no point growing a really long beard if you are totally bald on top of your head. Nature gave you so much extra hair. Why? Because so you could fill up your bald head when you had the need for it. Now if you start getting fixated with your beard and not getting your head filled, that would be a wrong thing. So if you are young, you can go for a hair transplant. Let's say you are 20, 21 years of age. If you have a lot of donor, and just keep in mind that you have to plan for your future also. So keep some donor for future, and then if you are young, we can still do your hair transplant. If you have a young friend who is in a similar situation, you share this video with him. Like this video, of course, and subscribe to our channel. If you have any other questions on which you would like me to speak about, do let me know. A beautiful hairline. He is a young gentleman and he is a Norwood 3, means he has lost hair from his hairline and temples, and he has lost his temple points also. So we place 3200 grafts in this case for a young hairline with full density temple points and the front hairline area. So here is his final result, and he is very happy with the growth. Now a lot of people ask me, why did I do such a young hairline for him? Remember, when a patient is losing hair and he is educated and he is aware and he has a lot of donor, then there is no restriction on giving a young beautiful hairline to a patient. So this is what we have done in this case. As long as you have sufficient donor, there is no restriction on young hairlines. Now we can transplant hair from your head also, from your beard also, and from strong hair from your body also. So for in any average Indian patient, you can get 10 to 15,000 donor hair grafts, which we can use. So this is why we gave us such a beautiful young hairline. If you have a problem in the hairline area, or if you want a young hairline for yourself or your friend, you go through this video and share this video with your friend also. And let me know, let me see your pictures also. Like this video, subscribe to it as well. Thank you.